Good afternoon, everyone, and welcome to our Northwell Health EMSL SAM Wellbeing webinar. Today, we're going to be discussing the implementation of a staff wellbeing initiative across the emergency medicine service line at Northwell Health. We'll start with an overview of Northwell Health system-wide wellbeing strategy and robust initiatives and programs, including our Team Well and our Team Well physicians. We're also going to highlight our systems partnership with the Lorna Breen Foundation, which supported efforts to remove stigmatizing language from our credentialing and onboarding processes. The session will then feature key EMSL wellness initiatives and their impact on staff, with physicians from our Western, Central, and Eastern regions sharing insights and spotlighting projects from their respective sites. So for today, our panelists are Dr. Jennifer Goebel. She is the Director of Wellness for Emergency Medicine and also the Chair for Physician Wellness at Huntington Hospital. We have Dr. Williamson, who's the Associate Chief for the Pediatric Emergency Department at Cohen Children's Medical Center. We have Dr. Annabella Salvador, who's the Deputy Chief Medical Officer and Senior Vice President for Medical Affairs for the Northwell Health System. We have Dr. Yvonne Gunta, who's the Division Director of the Department of Pediatric Emergency Medicine at Staten Island University Hospital. And lastly, we have Dr. Levine, who's the Director of Wellness at South Shore University Hospital. I'm now going to hand over to Jessica Sidle to kick off our panel discussion.
Hi, everyone. So first we have insights from Dr. Salvador. So please tell us a little about Northwell and your role within the organization, including how long you've been with the organization.
Thank you, Jess. It's a pleasure to be here today, especially to discuss a topic that's near and dear to most of us, and that's on wellness. As we know, healthcare is a demanding field, and we dedicate ourselves often to caring for others, and that's really at the expense of our own needs and health. Prioritizing our wellness should never be seen as selfish. It's essential for us to build resistance, to enhance our performance, and to deliver exceptional care. So as the Senior Vice President and Deputy Chief Medical Officer at Northwell, I have the privilege to work with multiple physicians, providers across our entire network on matters that involve credentialing, privileging, bylaws, wellness, professionalism, career development, and other clinical initiatives. I've been with Northwell for over 25 years, and I'm proud to share some of our demographics with you today and to talk a little bit about the system level initiatives that we've been doing. So Northwell is New York State's largest healthcare provider. We're an integrated nonprofit healthcare system with over 85,000 employees. We have 21 hospitals and 2 subacute nursing facilities. We have over 900 ambulatory practices. And as of May 1st, we will now be merged with Nuvance Health, which will add 7 new hospitals to our portfolio, and it will expand our scope into the Connecticut region. So this map that you're currently seeing will be outdated soon. So we're very excited for that new merger and to partner with our Nuvance partners on this wellness journey. Next slide.
Dr. Salvador, please share details about Northwell's well-being strategy and about the efforts under Team Well and Team Well physicians, and what progress has been made so far and what resources are currently available at Northwell.
Great. Thank you for that question. So this has been several years in the making. Northwell wanted to improve wellness, especially at the time we were really very focused on physician wellness. So we engaged with numerous physicians across the system to identify key priorities and develop basically a framework that physicians could relate to. We had multiple meetings trying to create the pillars that were part of this framework. And we actually, believe it or not, even worked on the logo, everything from the exact colors to each of those pillars, to the titles of each of the pillars and what each of the pillars would entail. When we were doing this work, our human resource partners were impressed by what we were coming up with. And they said, why are we not creating this for the entire team member experience? And that is when Team Well Physician and Team Well overall was created. And we've since now used these as our framework when we're talking about wellness in our organization. And as you can see, the two basically are very similar. The only real difference is in the physician. We call one of the pillars personal, and the team member one, we call it more financial, but essentially it's very similar. And this Team Well framework really inspires us to be our best, allowing us to really fully be present for not only ourselves, but for our patients, our families, and the communities that we serve. It also helps connect us to our purpose of why we went into medicine, and it helps with the pursuit of our well-being goals, in addition to finding a sense of belonging within our organization. And then each of the pillars has a list of resources that's attached within that pillar. Actually, if you can go to the next slide, I think we have an example here for you. And this is, again, Team Well Physician as the center, the core. And you can see here, these are just some examples of some of the resources that we have in each of the pillars. So for example, when you're talking about intellectual, there are 22 different programs that are embedded in there. Things like our relationship-centered communication, which is courses that teaches physicians. It's physicians that teach other physicians how to build relationships when they're speaking to patients and families and relating to each other. We have our CLI, which is our Center for Learning and Innovation, that has many courses that individuals can learn and develop their careers. So again, there's 22 programs there. But if you look at the other pillars like the physical, there is things like personified health, which is an app that has it's an online platform that encourages employees to take journeys. It also has the yearly health assessment on there. There's meditation apps. There's all kinds of different emotional and physical learnings that you can learn on that app. We have also, if there's a program that you can think about it, we could probably have it within these scopes. I think sometimes our own team members don't realize how many programs that we actually have. We have programs even for women on menopause, lactation. We have all of our BERGs, which are our business engagement resource groups that people can join, and this helps with their social pillar, where they can work with others that have similar interests. So we have the African American Bergs, we have the Asian Bergs, we have the multi-faith Bergs. So this is what we use as a framework. When you go on to our internet, which is our platform where we can find all of our resources, you can go into this area where we house the Team Well physicians and look up any of these programs and use them. So it's really been fantastic. I think our team members have really enjoyed it. Next slide. And these are just some of the other system level well-being work that we've done. We've been really focused around mental health. So we have programs that we call like Be Health. We have the Center for Traumatic Stress, Resilience, and Recovery. We've also trained a lot of our physicians and providers on stress first aid, how they can recognize stress in each other and to provide resources for those individuals. We have chaplaincy services. Our employee and family assisted program and our physician resource network has been instrumental in also providing resources for our team members. We often do, for example, like when flu vaccines are available, not only are we vaccinating our own team members, but we're offering it to their families. So we have lots of family resources. We have Northwell Kids, which are programs for the children of Northwell team members. So these are just some examples of resources that are available. We also have within our physician group, we have which we call Northwell Health Physician Partners. We have several committees there, and one committee that we have is Wellbeing Committee, and that focuses on the physician's well-being and creating resources for physicians. And within that committee, there are resources such as Connect the Docs, which is a dinner that you can bring other peers with you. And it's an opportunity to have a sit down with your colleagues to discuss things that may be of relevance to you at the time. And it's just a nice way to network with other peer physicians. So again, these are just some examples. We have many, but we wanted to share this with you today.
Dr. Salvador, please tell us about your work with All In and the Lorna Breen Foundation and the work with the AMA.
Great. I think out of all of the initiatives that we have at Northwell, for me, this is the one that I was probably the most passionate about. This time of year is very difficult. It's been just over 5 years ago on April 26th that we lost Dr. Lorna Breen. As an emergency medicine physician, I had the honor of knowing Dr. Breen, who was a brilliant and very dedicated physician leader. Lorna completed her residency here at Northwell at our Long Island Jewish Medical Center campus. Following her residency, she went on to become the site director of Allen Hospital, which was part of New York Presbyterian. And while she was there, unfortunately, she passed by suicide, and her passing left the emergency medicine community very heartbroken because we kept thinking if this can happen to Lorna, it could happen to any one of us. So during that time, it was very difficult. I know Lorna had been working very hard in emergency medicine during the pandemic, and then she also had COVID, and she was very tired, sleep deprived. She was sick, and the family described her as almost catatonic. She had reached out to her sister, Jennifer. They tried to help, but unfortunately, we lost her to suicide. Her family then created the Dr. Lorna Breen Foundation, and a part of the reason was because Lorna, at the time when she was having this experience, felt that she was going to lose her job, or she had concerns about seeking mental health treatment because of the fact that she thought she would have to report this to somebody or that her job would be at jeopardy. So her family, both her sister and her brother-in-law, Corey Feist, created the Dr. Lorna Breen Foundation, which has really done an incredible job in trying to support mental health for not only physicians, but all healthcare workers. They've passed the Dr. Lorna Breen Act. They've created policies around providing mental health for healthcare workers. And one of the biggest things they also did was to help change credentialing and state licensing questions on the applications so that people could feel comfortable seeking help when they needed it the most. And so at Northwell, we felt it was our responsibility to support our team members in being able to seek help. So as the Senior Vice President of Medical Staff Affairs, the credentialing falls under my purview. So I had asked our team, we got a team together to change the credentialing committees, the credentialing application questions, and we changed them. And what came out of that was not only did we change the credentialing application, but it allowed us the opportunity to look at other forms that we had in the system, including in our employee health services, including in our HR, in our bylaws, rules, and regs. So we actually made multiple changes in multiple documents across our health system because of this initiative. And Dr. Lorna Breen Foundation created an all-in well-being first for healthcare champion if you were one of the hospitals that changed your credentialing questions. And so early on, we were recognized as one of those. Actually, we applied for all our hospitals. So as a health system, we received this recognition the first year that it was offered. So that was in 2023. And then again, we reapplied in 2024 and were recognized yet again. Actually, we were one of the first health systems in the country. We were one of 12 to get this recognition, and we were the first healthcare system in New York to obtain this recognition. So this is something we're really proud of, and we feel like we're honoring and supporting Dr. Lorna Breen and the work that her family has been doing in this space. So thank you.
This is fantastic. Thank you for sharing that. Dr. Salvador, please tell us about the emergency medicine service line.
Great, thank you. So we can go to the next slide, and this will be really brief. So just as far as emergency medicine, we have 18 emergency medicine departments, one freestanding emergency department, which is in New York City. And we have a joint venture with Goebel Health. So we have over 60 Goebel Health urgent care centers, and these are scattered throughout New York and some in Connecticut now. We also have the NETS program, which is a telemedicine for emergency department. As a system, we have almost close to 1 million visits, and we have over 180 advanced care providers with over 500 physicians. So we are a pretty large emergency medicine service line and very proud to be part of it. Thanks, Jess.
Thank you so much, Dr. Salvador. Next, we have Dr. Goebel. Dr. Goebel, please share insights about EMSL's wellness strategy?
Sure. Thank you very much for having me. So before we talk about the emergency medicine service line and our well-being initiative, just wanted to touch upon this slide. Many of you have seen this data before. This comes from Medscape, but as we know, emergency medicine has the number one burnout among US physicians by specialty. And although we want to be number one, this is not something we want to be number one in. As we can see, all specialties are affected in some way. And when we talked about building an emergency medicine service line well-being initiative, we wanted to make sure that we took a really focused approach and really understanding the problems as far as the stressors and drivers of burnout before developing sustainable solutions. We can go next slide. So here you'll see our mission and vision statement. The emergency medicine service line has had a wellness committee since April of 2021. And in January of 2024, we revamped the committee to have a mission and vision statement. As you can see, the mission is to unite team members across emergency medicine to collectively address challenges related to employee wellness and actively seek solutions. And our vision is to envision a future where collaboration across emergency medicine and Northwell Health enables us to enhance wellness while supporting a culture of resilience and support throughout the organization. You can go next slide. So here you'll see many members of our committee. We are a multidisciplinary committee representative of all of our 18 emergency departments and our Go Health, which is our urgent care partner. We have 2 committee chairs and we have project management support. And so we meet monthly to discuss system, service line, and local level well-being initiatives. Next slide. And as I stated, before we ran to solutions, we wanted to understand the problem. So we sent out a well-being survey in April of 2024 to all our 18 sites and our Go Health, our urgent care partners, and received back 648 responses. So the well-being survey came from the Institute for Professional Work Life, the Mini-Z Inclusive. It asked questions such as satisfaction with current job, great deal of stress because of my job, sufficiency of time for completing one's work. There was a question specifically on burnout that we'll talk about shortly. Using your own definition of burnout, please circle one of the answers below. We asked a question on control over workload, question on describing the atmosphere in your primary work environment, professional values being aligned with those of their direct leaders, the degree to which my team works efficiently, the amount of time I spend at work at home, workday being mainly frustrating. And then there was a question at the end. It was a free text question where we asked our staff to tell us more about our stressors and what we could do to minimize them. We also asked questions as far as where the staff member worked, what their occupation was, and the number of years that they were with the organization. So as you'll see on this slide, just looking at results from one of the questions, looking at the question on burnout, using your own definition of burnout, please circle one of the answers below. You'll see that out of these 648 responses that were multidisciplinary, all occupations across our emergency departments and our Go Health colleagues, 20% of our respondents had no symptoms of burnout, but 80% were under stress, definitely burning out, symptoms of burnout that they're experiencing won't go away. And 5% of these respondents felt completely burnt out to the point where they may need to seek help. So question became how we went about helping the staff, developing evidence-based programming, and doing so in a way that maybe some staff members didn't want to raise their hand to ask help. And as Dr. Salvador spoke about, we have comprehensive and amazing programs throughout our organization, and we wanted to develop some specific programs that were targeted to our emergency medicine staff across the service line.
Thank you, Dr. Goebel. Can you please elaborate on your work with the EMSL wellness initiatives?
Sure. So the first program that I wanted to touch upon was our peer-to-peer program. So peer mentorship, as we know, is very important, especially in the well-being space. And feedback that we received from our survey is that people wanted to have a specific program for emergency medicine. Across Northwell, we have excellent programs, excellent leadership programs, and mentorship programs, but there was no specific program that was specifically for emergency medicine. So we developed a peer-to-peer program. We piloted it this year. We matched newly onboarded staff, those were physicians and ACPs that were newly onboarded from June to September of 2024, with experienced mentors across the service line. We asked both our mentors and our mentees to fill out intake forms that asked their occupation, where they worked, what they were looking to achieve in their career, and their interest. And we piloted the program in September of 2024. And so the aim of the program was to ensure that our recently hired, our newly onboarded physicians and ACPs were paired with experienced mentors who can guide them through their initial transition period. And as we know, that 0 to 2 year range where people are just coming out of training and residency can be very challenging. We wanted to increase the retention and keep people within Northwell and the service line and enhance their integration and development across EMSL and as I said, the Northwell Health. So this was a 6-month pilot program between September and April of this year. We matched our mentors and mentees regionally to encourage in-person meetings. We also had, in the beginning of this month, a peer-to-peer social where our mentors and mentees came together. They networked, they got to know each other. And we also sat down and had a really great discussion on how we can continue to grow and expand this program, which we're planning to roll out again in September of 2025 of this year. Really good testimonials from the program. I had a chance to meet someone new who was amazing. My mentee and I are planning on doing a PEM podcast together in the future. So really positive, really nice to see. And I'm very excited to continue to grow and expand the program. So we did talk a little bit in the beginning of this webinar on emotional well-being. So one of the initiatives that we worked on is, as we know, September is Suicide Awareness Month, National Physician Suicide Awareness Day, September 17th. In our committee, we had a really good discussion on how we can go about recognizing the day. As we know, 300 to 400 physicians will die by suicide each year. That number is staggering. And so really, as a committee, we came together and we decided to make postcards. So these are the postcards that we dispersed to all of our sites. We made 1,000 postcards, the front and the back. It had the signs, the potential warning signs to recognize, and then resources within Northwell. Some of them were listed, and then there was a QR code that took us to our system intranet to be able to access those resources. We attached little pins to the postcards, and just really special initiative that we did across EMSL. Here, you'll see a flyer from our career development panel that we did in November of 2024. This also came from feedback from our survey. People really wanted to have a panel, career development, just to really get to hear people's experiences. So here you'll see 3 physicians and 2 ACPs that participated in our career development panel. They shared their personal experiences in emergency medicine, work-life integration, career development, peer mentoring. Really good discussion and dialogue came from the session. We had 70 participants who attended, and a post-survey showed that 82% of the attendees strongly agreed that the panel positively impacted their well-being. Last month, in honor of National Healthcare Wellbeing Day, the Emergency Medicine Service Line organized a wellness retreat. All staff across all of our sites were invited, and this was just an opportunity for staff to take time out of the department to prioritize their own well-being. We had a 3-hour retreat that was at our Center for Wellness and Integrative Medicine on Long Island. We did a Pilates session, we did a lunch with a nutritionist, we made soap scrubs, and we did a sound healing event, and really nice and special. And as you can see from the testimonials from the event, it was a very restorative event. Emergency medicine providers will really benefit from more activities. So great to spend the day with other EM physicians from other sites who truly understand our day-to-day. Post-survey data, high satisfaction with the event, definitely positively impacted their well-being, and people want to see more of this in the future. So really nice to see. Also, in the beginning of this month, we held a litigation support session. This session came from feedback actually from our career development panel. Someone on the line had raised their hand and asked for this. So we answered. So we coordinated a litigation support session that was held hybrid, both in person and on Teams. 2 leaders from the organization from our risk management team presented a session that they entitled The Anatomy of Medical Malpractice Litigation. They discussed topics such as risk mitigation strategies and also focused on documentation best practices. A post-survey asking the attendees on a scale of 1 to 10 their overall confidence as it pertains to litigation. It was a 5 pre-litigation session and an 8 post-litigation session. Definitely a lot of education during that session. Some testimonials, such an informative session. Would love to attend more sessions like this. Continue these sessions, so valuable. Really good feedback, and we're planning another session in the fall. Next slide. Here you'll see our EMSL Wellness Toolkit. At the beginning of this year, another area of feedback that we got from our committee was that people wanted to have some system resources and service line resources all in one place. In such a large organization, as Dr. Salvador was mentioning, sometimes it's hard to navigate. We have such great programs and initiatives, and just finding them sometimes becomes the challenge. So we created a one-pager where we have our mission and vision statement from our wellness committee. There's a QR code to Ask HR. That's Northwell's 24-hour digital assistant for everything HR related. A QR code that links us back to our system framework, the team of physicians that was discussed earlier. On the bottom of the toolkit is where we highlight our peer-to-peer program that we discussed, a wellness CME series, which we're really excited to be rolling out in the fall, and a little paragraph about our wellness committee. There's also a QR code that takes us to our SharePoint, where we highlight some of our work and actively continuing to update that. Next slide. And lastly, before I pass it on to my local level physician champions, I just wanted to highlight, when we talk about 2025 and the goals of the Emergency Medicine Wellness Committee and Emergency Medicine Wellness Initiative in general, we're looking to continue to enhance engagement and representation across all of our sites. As I said, we have multidisciplinary monthly meetings. We want to continue to foster collaboration and integration across the service line and system initiatives. We're asking all of our sites this year to work on a well-being initiative and measure it. We know that well-being is important, but we want to show the impact. We want to continue to expand our peer-to-peer program, our peer mentoring program. We're working on a wellness CME series that we're hoping to roll out in the fall on key topics that people are asking for: litigation, workplace violence, microaggressions, FemEM, so many topics, and we're really excited to roll that out. And lastly, we want to develop and implement comprehensive communication and resource tools. We want to make sure that people are aware of the services that are available and the work that we're doing. So our wellness toolkit, which I showed you, our awareness months, National Physician Suicide Awareness Day, quarterly newsletters across the emergency medicine service line, our wellness SharePoint, where we have the work that we've been doing, and lastly, presenting at national conferences to be able to share this work across other organizations and to learn from other organizations. We'll be presenting at AAPA in May, and for those who will be attending, ASAP will be there in September.
Thank you so much, Dr. Goebel, Dr. Salvador, as well. It's been such a great conversation so far. So our next question is for Dr. Gunta. So Dr. Gunta, can you please share your experience at Northwell and your role in wellness at Staten Island University Hospital? And if you can also tell us about some of the work you've been involved in.
Sure. Thank you so much. Good afternoon, everybody, and thank you so much for inviting me. Again, my name is Yvonne Junta, and my primary role is as a division director of the Pediatric Emergency Department at SIUH, or Staten Island University Hospital. But I've been involved in the Wellness Committee since its inception, which I guess was now April, like Jen said, April of 2021. So at Staten Island University, we really emphasize wellness every day in different ways. And we try to enjoy each other's company by going on hikes and going to dinners, and we call them family lunches, and going to sporting events together, et cetera. But we really say that our primary focus for wellness is to focus on work-life balance. And we really prioritize that. As far as work balance goes, as a group, we really try to find creative ways to decrease our stress during the shift and take those so-called pebbles in your shoe and find ways to decrease those pebbles. And if we find those pebbles, we try to address them as creatively as possible. So I am going to highlight the program that we started. Aside from that, though, we also focus on, of course, our life balance, which we think is the most important part of wellness. And our medical director, who also is our scheduler, he really does a fantastic job at optimizing our schedule in a way that prioritizes our requests, but also optimizes staffing. So today I'm focusing on our program that we created, and it's called the Patient Advocacy Program, the Emergency Medicine Patient Advocacy Program. We call it MPAP for short. And this is a program that, with the help of our medical director, our patient experience officer, and our director of community outreach, we created. And essentially what we've done is created a program where we've merged 3 different populations: our providers in the ED, our patients, and our community, and came up with a program that really benefits all 3 and creates a very incredible wellness project. And we've already been gathering some numbers for this initiative and possibly publishing a project out of this. So essentially what we do, and this here is how the volunteers register, but we get community volunteers, and the volunteers are essentially students who are interested in pursuing a career in medicine. And they apply to this program, and they work in the emergency department for 6-hour shifts. And what they do is they alleviate our staff, including our nurses, ACPs, attendings, residents, of some of the more distracting tasks that could sometimes be those pebbles in your shoe. So for example, getting a blanket, getting a glass of water, finding patients, family members, looking for results, if they want a sandwich, anything like that, that does add up during the day and take time away from your shift. It's distracting, and it really helps the staff out. So these volunteers apply to be part of this program, and they work in 6-hour shifts, and they are getting the benefit of not only getting experience and exposure to the emergency department setting, but they are also meeting many of our attendings. They can get letters of recommendation, but more importantly than that, they are also given as a reward educational lectures in return. We give them, aside from lectures, simulation. We teach them ultrasound. They are observing procedures at times, and they can learn procedures as well through our simulation. So these volunteers are usually from local colleges, and they're interested in pursuing a career in medicine. So it helps them, and it definitely helps us as well. And with that as well, it is increasing patient satisfaction, because all those little things that patients often complain about, that I just want a blanket, I don't know where my mother is, things like that, these volunteers are there to help with. So we have them stationed here at a help desk. And if they step away for whatever reason, maybe to walk a sample over to the lab or to go help somebody find a loved one, they just put a sign up that says, "Be right back." And if you're working a shift as a provider and you need the volunteers' help to go grab somebody a glass of water or get a blanket, they are all carrying their own spectra, which they pass on from shift to shift, and they are very easily reachable. You just call them, tell them what you need, tell them where the patient is, and they go complete their job and then go right back to the help desk. And again, their shifts are 6 hours at a time. So we have gotten some data of the total number of interactions they've had per shift. And we just started collecting this in January of this year. But essentially, we're seeing that in a 6-hour shift, they are having approximately up to 10 to 19 interactions per shift. And that number is going up now that we're making people more aware of the program. And the tasks that they most frequently perform is they help bring patients food or water, they bring blankets or pillows, they help family members find patients and take specimens to the lab. So that is our initiative. We are still collecting data, but have already started to write this up, again, with the help of our patient experience officer and director of community outreach in the ED. And again, this is the MPAP program. We are accepting more volunteers, and anyone who is interested in learning more about this, I'd be happy to be contacted directly. Thank you.
Thank you, Dr. Junta. All right. All right, so next up we have Dr. Williamson. Dr. Williamson, can you please describe your experience at Northwell, your role with wellness at Cohen Children's Medical Center, and some of the initiatives you've worked on?
Thanks, Jess. Thanks for having me. Again, I'm Christy Williamson. I'm the Associate Chief in the Pediatric ED at Cohen's. I'm going to talk about something a little bit different. So my passion for wellness is more about like how we as a system, whether that's Northwell or your individual emergency department, can help make your job better. So you have more time to focus on your own wellness, whether that is in or outside of work, but you know your own wellness better than anyone else. So I title this, and what I try to focus on is working smarter, living better, the wellness impact of workplace efficiency. Most people think about workplace efficiency in terms of metrics and operational, but I like to connect it to wellness here at Cohen's. You can go ahead. So I'm going to talk about just a few simple projects that we did over the last year or so, hopefully just bringing back some things that maybe you can bring back to your ED. The first one, we all know that charting and the EHR is really a deterrent, and people just hate it, and it really takes away from your wellness. This is a quick study just to look at on the left, showing that in, for example, teaching physicians, 88% attribute work-life balance to your EHR, and 83% attribute experience of burnout to EHR. So we wanted to do something about this. A few years ago, we implemented drag-in dictation services in our ED, but most people were using their cell phone. This was helpful, but we just found a lot of people not using it. I think it's partially people forgot. Maybe they didn't want to drain their battery. Maybe it just looks bad to hold your cell phone when you're talking in front of families and patients. So I really thought getting these actual microphones connected to the computers would help, but I needed to fund them. So I applied for a grant through our NHPP, and they graciously gave me a grant to buy 4 of these microphones, which obviously are not cheap. We connected them to 3 of our attending computers and 1 in our office, which I'll talk about. And I did a slow rollout of this. I taught people how to use them. I gave them little cheat sheets, sent emails. We had one of our experienced users do a little session during one of our provider updates just to show people how to use it. And now you walk around our department and people are constantly using them. I just sent this survey which says, how would you rate the impact of these drag-in dictation microphones on your efficiency in completing patient charts in the ED? And everyone said something positive. Almost 70% said it significantly increases your efficiency in the ED. You can go to the next slide. Go ahead. So this question says, thinking about your overall wellness during a shift, how would you describe the impact of using drag-in dictation microphones on your stress level, specifically related to charting? And, I would say up almost 30% said it significantly decreases their stress. We put so much money, time, and effort as an organization and as an emergency department into trying to relieve stress and improve efficiency. And this was such a simple thing that I think really helped people. And then furthermore, that says, do you feel that the drag-in dictation microphones influenced your ability to leave on time at the end of the shift? We all obviously love working or we wouldn't do our job, but it's nice to get out on time, to get home to your family or whatever you love to do. So this showed that 60% of our physicians that use the drag-in microphones were able to make it more likely that they leave on time from their shift. So, it helped efficiency, which obviously helps operations, but also decreased stress and leaving on time. These are some other small projects that we did. We didn't really have a space to kind of congregate. We know that we as emergency medicine providers, we kind of like to talk to each other, and we really didn't have a place to do that anymore. So I found an office that people weren't really using, and we basically made it a space. I put a survey out that says, do you think you would spend more time pre and post shift if the space was more conducive for working? And almost 80% of our providers said yes. So I did very simple things, cleaned it out, threw away a lot of stuff, made working computers that were quick, added a printer, added a drag-in microphone, added some snacks and water and candy. And really, I think it's been received. People go there to do separate work, to do a little teaching to individual students, to sit and eat during a shift together if they have 5 to 10 minutes. And I think it's really been such an easy win for our staff. A few other things that I try to focus on, Dr. Junta says the schedule is so important, right? So I would like to optimize your schedule system to alleviate burnout. We know there's been a lot of studies showing that adverse effects of constantly rotating your shifts is the single most important reason for premature attrition from our specialty. So we know that this constant movement of day to evening to overnight is why people leave clinical emergency medicine. Obviously, we can't take away the 24-hour part of EM, but we can do our best to optimize our schedule for our providers. So I try to sit with all my docs and try to look at their preferences. I try to plan ahead, at least a few months ahead of time, so people can get their life in order. I try to rotate your shifts in a clockwise manner. So doing like a day shift, then an evening, and then an overnight shift, and then having some days off. This really has in the literature been shown to help sleep and overall wellness. And then recognize your chronotropes, right? There are morning people and there are night people. So if it's fair in your department, try to get the day people, the morning people to work the mornings and the night people to work the nights. So it's just little things like that. So sit with your scheduler and try to optimize your wellness and take this seriously. This isn't something that you can just put on the back burner. Try to really make it work for you and your department. And the last thing, it's just some overall thing to make things easier. So providing useful, easy to access resources to help take care of the patients. So we know we get 1,000 emails a day with a million different sites to check for this or to check for that, or a new policy sent out by the chief, and you can't remember if it was a text or an email. So I try to keep all the documents in one place and try to put pertinent updates in one place for people. I try to provide administrative assistance from some of our admin when appropriate. It's less mundane tasks for you. I try to provide EMR shortcuts and acronyms to try to, improve your time charting like we talked about, and just simple things like that. Obviously, there's many more examples, but I was just trying to give some kind of objective ways to try to make your life easier and to improve your efficiency in the ED. This way you can decide whatever wellness you want to work on for yourself and optimize that. Thank you so much.
Thank you, Dr. Williamson, for all the insight. All right, so next up we have Dr. Levine from South Shore University Hospital. Dr. Levine, can you tell us about your experience at Northwell, your role in wellness at South Shore, and some of the key projects you've contributed to?
Sure, certainly. Thank you for having me. I'm excited to be here today and share with you. Like Dr. Salvador, a longtime Northwell employee. Although when I started in 2002, South Shore University Hospital was a different name and we were not affiliated with Northwell. So I started in quality and worked in the emergency room throughout my kind of journey, went on to compliance and then utilization review positions that were administrative. I became involved in wellness when I started working with the family practice residents. And it was a very positive experience for myself as well as for them. I got very good feedback from them and subsequently became the director of wellness in the emergency department. From there, I became director of the emergency medicine residency program and then staff and physician wellness, and that morphed into absorbing the next several residency programs that we grew into as we became a university hospital, and that was post our affiliation with Northwell. So once we became affiliated with Northwell, that was really when I phased out of quality and compliance and education and that sort of role and became involved in wellness. I really believe that our in-hospital community has to focus on wellness if we're going to take care of our out-of-hospital community. And that was my impetus to spread this throughout the hospital. So currently, my role is multifactorial. So I am the director of wellness as well as patient experience for the emergency department. I'm the director of wellness for the hospital, which includes our staff and our physicians, and then for 4 of our residency programs, which includes emergency medicine, transitional year residency, internal medicine, and our surgery programs. So it keeps me kind of busy. If you want to go to the next slide. So in the emergency department, our pillar that we most focus on is social wellness, and that would be followed by emotional wellness. And you saw the circle with all the pillars in it earlier on in the presentation. So we have a lot of really creative people in the ED, and what we tend to like to do is anything together. So any initiative. So you see a picture of us with our raising awareness about gun safety, and we give out lock boxes. We're all excited to wear our t-shirts on the same day. We do decorations for the holidays and we'll have a holiday meal together. We just had our annual Easter egg hunt where if you find the golden egg, you actually get a prize. And I don't use real eggs, so the department doesn't stink after 4 weeks. But people really love it. We have annual trips to the Yankees and the Mets, and we have a program called Take a Hike. So we also get out and we go to one of the local arboretums or parks, and we walk together, and we do connect the doc dinners as well. One of the favorite things for us is our wall of what we call positivity, which I don't take credit for. It was one of our PAs, but we really love our pets. And so we have this whole wall of pictures of our pets, and it really decreases our stress during the shift just by looking at them. So there's a lot of support, personally and professionally. Emotionally, which is our second most frequently asked for pillar, we do stress first aid wellness check-ins, and we do them quarterly. I do that with Dr. Anne Marie Wachamontes, who comes from the Center for Traumatic Stress Resilience and Recovery, which is one of the programs that Northwell offers. That center also does resilience coaching and individual well checks. And it really means a lot to the staff. When we round, we give them in real time methods to deal with stress, because the emergency room at South Shore is a very busy emergency medicine facility. The next slide, please. So for our resident wellness, I meet with our residents every month, and we talk about a different topic that has to do with wellness, whether it's substance use disorder or second victim syndrome. It's just all the things that are pertinent to them in their growth and in their careers, actually. For our emergency medicine, we have an annual wellness day, and you can see actually that's two of our attendings doing paintball, which was our first class that we ever did that with. And then we do social events. We have a Friendsgiving event. Last summer, when the residents started, we actually did our very first ice cream social, which was very well attended and appreciated. They do a lot of social gatherings on their own. They do trivia a lot at our local facilities. I've sent out wellness surveys, and I do individual check-ins with them just to keep a finger on the pulse of how our residents are doing. And each program that I'm involved with gets their own survey. I don't identify anything. And then I can see if one group or multiple groups have any specific issues going on that I need to follow up with. They all have my cell phone number, and they know they could probably reach me about 18 out of 24 hours a day for any kind of an emergency, whether it's a personal issue and they need a referral for AP or a mental health wellness facility that we have solely for residents. They know where to grate corned beef sandwich in the area. So it's a very open door policy with them, and I think very effective. For physician wellness, our docs were really interested in not just physical well-being, and we do have a wellness center where they go, they work out, they decrease the stress, but a lot of social events as well as intellectual well-being. So you can see on the top left, this is a bunch of ER docs and one of our hospitalists at one of our regional physician get-togethers. And I created this year in order to build collaboration between the departments, interdisciplinary grand rounds. So we address intellectual as well as social well-being in one fall swoop. They attend our wellness events for the hospital, which are wellness fairs, which share information about all of our resources, which sometimes it's hard, again, and I know you've heard this before, we have so much that it's hard to know all of our resources. And so we have these wellness fairs, and that really covers a lot for our physicians. I was also able to have administration sponsor social events outside of the hospital. And it's a really great environment to get to know your fellow physicians throughout different departments in a non-hospital setting. And I think that's created the biggest value for our physicians at South Shore. And then finally, for our hospital staff, next, there we go. So our physicians also participate in our overall staff wellness initiatives. Probably my proudest initiative, and you can see in the bottom left photo, was the creation of our wellness center. It took 2 years to get that established, but it has a yoga studio and it has a full gym, like a circuit gym with an elliptical machine, a treadmill, and a Peloton. And both staff as well as our physicians really use that as a major source of de-stressing during the day, before the shifts, after the shifts. Anytime that we have an equipment failure, like, people are definitely very verbal about, I need to get to the gym, which is great because we want our staff and our docs to be healthy. We have a wellness cart that goes to the floor and it dispenses little self-care items and wellness information, whether or not it's about a webinar or just our resources alone. We do Narcan training, floor to floor, day shift and night shift. And the biggest issues for our staff overall, because they had a separate survey than our docs, was really financial, emotional, and physical well-being. So the Wellness Center definitely lends itself to that. For financial and emotional, we have EAP office hours on a monthly basis. We have chaplaincy tabling on a regular basis. So they have access to those offerings that can help them in those areas. Financially, there's a lot of young staff who have children who will one day be in college, and saving for college education, saving for retirement for all of our staff members is really important. So we have our financial partners come in also on a monthly basis who will offer free consultations privately with staff members. So it's made a big difference. Additionally, we do some fun things like our wellness fair where we share information about our offerings, but we also promote our staff from within. So any of our staff members that have, for example, side businesses, we will have a wellness kind of retail therapy fair or event, and they can promote their business. And those are also very well attended and appreciative. So there's always something going on at South Shore for wellness. It is multifaceted and designed for whatever segment of our population, whether it's residents, the emergency department, our physicians, or our staff. That's it. Thank you.
Thank you, Dr. Levine. All right. And we also wanted to thank everyone for joining us today and for being part of such an engaging and insightful discussion. A big special thank you as well to our panelists for sharing their time, experiences, and valuable perspectives on wellness. I know that we are at time, we understand that, but we just wanted to, before we officially wrap up, we wanted to open up the floor for any final questions. Feel free to unmute yourself or drop your question into the chat.
Oh, thank you very much for the quite engaging session. My submission or my comment, in addition to what others had said, is to get feedbacks from residents, physicians after each of those sessions, the staff, and use it to overhaul the exposition sessions that you have with them.
Thank you so much. We do see the question in the chat. We appreciate it. Thank you.
In answer to the question in the chat, Northwell Health Physician Partners started a well-being grant. That's through our organization. And that was the grant that Dr. Williamson and actually Dr. Levine on the call applied for and got. So that is through our organization, at least that particular grant.
How do you apply for that? And what are the timings? And are they doing that again for this year? Is that grant money only for a year? Is it continuous? How does that work?
Sure. It's through NHPP, actually Team Well Physicians. There are plans to be doing it in the summer of 2025. I don't have the exact dates, but it's for a program. In Dr. Williamson's case, it was for one particular initiative for the Dragons. Dr. Levine is doing a peer support program, and I apologize for speaking for you. And so hers is ongoing. But Anjali, when I find out the exact date that it's rolling out again, I promise to share it with you.
Awesome. Thank you.
You're welcome.
But Jennifer, just to add to that, it is, I think, a one-time, it sounds like it's like a one-time amount, but then I guess people could maybe reapply if they needed to.
I
Nancy
think Kwan.
has her hand up.
Were you calling on me?
Yes, Dr. Kwan.
That was a great presentation. Thank you so much. And I know we're over time and maybe my question is a little complex, but I think emergency medicine has gone through so many iterations as to what we serve, what we do through COVID, and now through changing political times. what do you think the future needs to bring, whether it's in innovations or new directions for wellness to emergency medicine faculty and staff in order for us to sustain and not get burnt out?
That is a complicated question. I would start off with, I think we need to be really careful about the regulatory space that we're currently living in, as many with the politics that are going on, and emergency medicine, at least in the New York space, has always been this sort of safety net for a lot of initiatives. So I get worried when we're dealing sometimes with our New York State Department of Health that often they will look at these initiatives and push everything to emergency medicine. We saw that with the HIV testing. We saw that with hepatitis testing. We're supposed to be screening for suicide, need to be screening for domestic violence, trafficking. There's so many different things that they want us to screen. And now recently we've had changes with behavioral health and having to create appointments for patients in the from the emergency department, which has created a lot of sort of chaos and concerns for emergency departments, which we're trying to work through. But I think first is it's important for us as emergency medicine physicians to also be advocates. So I would recommend that everyone on this call become an advocate. And that means, joining your societies, working with your state Department of Health, working with your government officials to really, advocate for the things that we need in the emergency department, but also question the things when they try to put things in the emergency department. Because unless you're at the table speaking and raising your concerns, nobody's going to really, listen, and they're going to continue to do it. So I think wherever you can advocate and participate in that, a lot of hospitals have government affairs societies, or people that are involved in government affairs, get to know those individuals. Go to Washington during advocacy days. Go in New York, we say go with New York ASAP to the state and advocate for those. So be active.
Thank you for that.
Thank you. Don't see any other hands. Thank you, everyone. I guess if anyone wants to, they can reach out to us individually. Otherwise, we appreciate everyone's time today.
Yes, thank you.